A lot of times I have patients who come to see me wanting some sort of breast surgery, and the two common options are implants or a breast lift. But for a lot of patients, they need both of those kind of together. And historically, that is a challenging procedure. It's hard to combine those two things for a number of reasons. Because of how I trained and who I trained with, Dr. Holly and Simeon Wall, and my time in fellowship, I feel very comfortable putting these procedures together, and I can still do it in a way that is safe for my patients, has very low complication rates, and really nice, beautiful long-term results. Mastopexy augmentation is an outpatient procedure. You come to our surgery center and you can go home the same day. Typically, I place the implant first and then I do the breast lift around that implant. For patients who are smoking, I have them stop at least 2 weeks before surgery because it can have such bad effects on the blood flow to the nipple. And I do have my patients do nicotine testing 2 weeks before surgery and also the day of surgery because it's something we take very seriously. One other thing that I think is important to touch on is some patients know they're clearly candidates for a lift if they have a lot of sagging breast tissue, and some know that they're clearly candidates for an augmentation if they just want some volume. But there's a lot of patients who are sort of in this middle bucket where they're a little bit borderline. And for those patients, it's really important for me to talk to them about their goals, what their ideal result is, and what procedure is going to be best for them, and if they in fact need a lift or if they don't. So that's a conversation I like to have in depth with my patients to really make sure we're on the same page.